It affects many different areas throughout our spine. Okay, we're going to move this around a little bit so we can remove that. We can come in here. I want to say howdy to all of our subscribers out there, to our chat room here, to Surprise and Deborah and Gerardo, Catherine. Hello, my friends. We got a great program, and the program is pretty much a request from hundreds of people, obviously worldwide, people complaining. Hello, Sandy and Paula. Hello, how are you? Diane. Hello, Janet. Hello, Catherine from Malaysia. Hello, Cheryl. Glad you're here with us. I think you're going to have a great time here. Olga, hello. Let's go to the program. We got a lot to share with you guys. I think you're going to enjoy this. This is about cervical radiculopathy, cervical radicular pain, pain from the neck coming through either into the shoulder, into the arm, into the hand, into the shoulder blade, affecting under the skull, over the head, behind the eyes. This is something that so many people have. So I'm going to go in some different situations, different possibilities of why you're having these particular problems. You can see right that picture right there, and I got a lot of things to show you, so we'll kind of move quick. Hello, Sash from Jamaica. Yeah, man. You know what they call me, Sash? They call me the Irie Doc here. For real, they do call me the Irie Doc over here in South Florida. Taking care of a lot of reggae artists myself. We'll talk about that another time. But anyways, cervical radiculopathy, you see that this young girl has pain radiating down from the neck. Hello, Eva from Oklahoma. Into the shoulder, into the hands. People can experience tingling, numbness, cramping. As we move here, so I'm going to kind of move around a lot here so we can see that the first thing that we develop many neck problems is from poor posture. Leaning over the computer, over the terminal, on our texting, just texting away, and I'm going to show you a whole bunch of different things here. If you look at this girl right here, you can see that she has excessive wear in the vertebrae. And we're going to talk about poor posture and how it degenerates the discs. There are so many people out there talking about how we can regenerate something that's degenerated. And people are arguing with me that there are ways, but until I see it, then I would have to agree with you. But meanwhile, at this point, I cannot agree with you. We talk about texting there. Look at the forward head posture. This, guys, looks real common, huh? Look at that lady in number 1. The old text neck syndrome develops when the head is not properly aligned. The neck is causing a curvature, a reversal of the curve. Let's look here, guys. You remember this, the normal curve in the neck, normal C-shaped curve. Obviously, when you look, we talk about a military or a straightening neck, or we look downwards. Hello, Patricia from Alaska. Debbie from Boulder Creek. You can see this forward head posture. This is destructing the discs. This is what's affecting the nerves. I'm going to show you all this, guys. I'm going to show you on the video, on the images here, and you're going to be able to understand a lot more. But you need to be certain that when you're texting, bring the object up, jut the chin down. You cannot bring the head forward. For every inch you go forward, it's an additional 10 pounds of stress. 3 inches is 42 pounds of stress. Your head weighs 12 pounds. You guys cannot really afford to have a neck like that, because that's going to really cause lots of problems. Let's go ahead and shut these off, and then I'm going to go ahead and touch on a few different things. Here, if you look at the MRI here, here's a herniated disc there. That's a herniated disc. You can see where the little bulge is in the middle of the neck. There's 2 bulges. I don't have a pointer, but we're looking at 1, 2, 3, 4, 4 and 5, 5 and 6. It's a cervical spine. Here, I want to show you briefly, we look at here, disc thinning. We can look at the x-rays there, and we can see that those discs, where it says disc thinning, you can see it, where those arrows are pointing to, that's degeneration. You see, when those discs, they act as cushion or shock absorbers. So when those discs degenerate, the bones get closer together. And obviously, when the bones get closer together, the holes right here, the yellow things, put it close to the cam here, the holes where the nerves are coming out become smaller. And we're going to talk about that. We're going to ask the reason, why do I get pain that comes out of the neck? Why am I having these problems? Well, we showed you here another herniated disc. You can look from the, looking straight down at the disc, you can see how it affects the nerve. And wherever that nerve is traveling to, you can potentially have tingling, numbness, weakness, cramping. And Janet, will come to yours. I see you said C5, C6. Yes, and we'll talk about that a little bit. Now here's a bulging disc and a herniation. You can see that the bulge or the herniation can still cause the same symptom regardless. So just because our herniation is causing compression on a nerve, a bulge can cause the exact same symptom or even worse, depending upon how it's affecting that nerve. Let me go ahead and show this condition here. You look at this. This is the nerve root that comes out of the neck. That's the brachial plexus. And it makes its way down through the shoulder here. It makes its way down the arm, into the hands, into the fingers. And anytime we have irritation along that nerve, that can cause many different symptoms. Here is something we showed you that one. Hold on one second with me, guys. I just want to make sure I don't miss anything here. Okay, so we look at cervical encroachment. Look at that picture there. That's encroachment. That means that where the nerve is coming through, you're getting inflammation on that nerve, and that nerve is not happy. That nerve is not happy right there, okay, on that right side. It's just affecting inside that foramen where that nerve's coming through, because as you degenerate the disc, the hole gets smaller. Very, very important. We talk about disc thinning here. The hole gets smaller where that nerve is actually coming out. Something here, let's look here. We talk about pain. Now you're saying, wow, you know, I get pain in the shoulder blade. I get pain in the back of the shoulder in the upper trap. I get pain off to the side here. I get pain underneath my skull. Look at the referred pain patterns. This is a very, very important chart. You need to go back to this chart because this will be posted on my channel in about an hour, hour and a half after after YouTube, not Facebook, after YouTube puts this on my channel. But these areas, particularly inside that shoulder blade, that C7, T1, a little bit higher, C6, C7, those nerves that are affected in the neck area cause those referred pains throughout different areas of our back. So this is a real good referred pain pattern. This is really, really powerful. All right, now, what about this, guys? We've heard of thoracic outlet syndrome, right? Thoracic outlet syndrome comes from three areas. This is one of the three. You see that area between the first rib and that clavicle, where that nerve comes through, you can get compression on that area affecting the artery or the nerve, causing numbness, tingling. Hello, Sandy Linder. Hello, Paula. How are you? Patricia. Shiny, just want to say hello to you. You can get compression on that area causing tingling and numbness and shaking and burning and coldness of your hands. Very, very important. And I want to show you another interesting picture. Right here are the other two ways of thoracic outlet syndrome. The scalenus muscle, see that nerve coming out? The anterior middle scalenus? That area right there can compress, giving you an artificial symptom of a disc. Even if you have a disc herniation, it cannot even be coming from the disc and still having those serious radiating pain into the shoulder, into the arm, in the shoulder blades, into the fingers. And look at the pectoralis minor muscle. That pec minor muscle, I'm going to stand up a little bit right under here, okay? I'm showing everyone my pectoralis minor muscle, so that's okay, guys. Hello, Says. Hello, Omar from Canada. Nice to have you here. Underneath the pectoralis, when that muscle squeezes down, it affects that brachial plexus, that TOS, the thoracic outlet syndrome, as well as the artery, and it can cause that tingling, that numbness. Now, it's so important. I talk about getting inside a door and stretching those chest muscles, because as our chest muscles contract, it pronates. It brings our shoulders forward. Woman with breasts, you have a similar problem. Hello, Razav. Pooja, you're talking about carpal tunnel syndrome. That is a separate entity. That is a peripheral thing. Hello, Darshan from India. But that pectoralis minor, when it contracts, it will compress. And you really need to get inside of a door. You know, put your hands inside that doorway and lean in and stretch. You can look at my video on stretching the chest muscles. I have lots of great videos on there. Go on my channel about some certain stretches. Very, very good. It will really help you to open that up. Okay, so let's go into a couple of important things. We look at dermatomes. Now, guys, if you notice, now I'm going to go over it with you. These two fingers, the first and second finger, is C6. Okay, and it travels up this side of the arm on the same side. And as you get up a little higher up, it affects C5. You can look at that chart there. The middle finger is C7. The last two fingers here are C8. Okay, you have 8 cervical nerves in the cervical spine. I'll get to your questions after, guys. But you need to come back to this, because if you notice that you keep having numbness in one of your fingers or in your thumb or your second finger or your third finger, you can diagnose your problem. You can help diagnose it to say, hey, hello, Lourdes from Mexico. You can find out where this nerve is being affected, because that nerve is a sign. It's like a puzzle. It's putting it all together to give you a better understanding. Look at this picture here. These are the nerve roots, the myotomes, and the dermatomes. Now let's talk about this. The myotomes, for example, affect the muscles, the nerves that affect the muscles. For example, if you look at the C5, see where it says shoulder abduction? Watch here. This is shoulder abduction. Abduction is abducting away from the body. Adducting is coming towards the body. So if we're abducting, we're lifting up. Now, if you notice that when you lift up, your shoulder is weaker on one side than the other, you potentially may have a C5 nerve root. You may also notice if you do this, okay, if you flex your, if you go ahead and if you extend your wrist and you notice when you try to extend it backwards and it's weak, that could be a C6. If you flex your wrist and you know it's weak, those muscles, that may be a C7. Now, the dermatomes will actually show you as well, but I like the other picture, particularly when it looks at the dermatomes of where the nerves are being, this area here, I like this view better. This is easier for you to understand. This will show you exactly the area that if you're experiencing tingling or numbness or burning or sensations in a certain area, you can relate to that puzzle, and that will pretty much tell you where that degeneration is coming from. So we have to understand that you're asking me, well, what are some good things to do? Let me get this here, because let me put that right there. You're probably saying, what are some good things to do if I got this compression here? Well, one of my favorite things, and one of the most inexpensive things, and I've been doing this for many, many years, we look at over-the-door traction. Now, the reason why I implemented this over-the-door traction unit into this particular module here is because everyone's asking me about it. What do you do? How do you do it? Well, I'm going to tell you what you got to do. These are very inexpensive, maybe $20, maybe less. Amazon, different areas carry these. But the reason, if you go on to the internet and you look at people doing it, they're all doing it wrong, about 90% of them. This is correct. I found one, because you need to be facing the door. Everyone else is facing the other way. They're facing right underneath it. It's pulling up like this. You want to be facing 20 degrees, facing that door. It goes up to 20 pounds of water. I would start out like 10, 12 pounds of water, and it will pull. And then you can actually, so you can lift up the bag, or someone can help you to maybe take a rest after a couple minutes and do it again. But let me show you why this is so important. This is the trick of how to get irritation off the nerve, all right? And I'm going to show you, because most people that do this correctly. Facing the door is correct, all right? Let me explain why. If you look at the nerve roots, here's the back of you, Okay, let me see if I can get close to here. Here is the back of you, and here's the front of you. Here's the back of your head, and here's the front of your head. Now, the nerve roots are coming at the disc level, right between the discs, and these nerves is what's coming out into the shoulder, into the arm, hand, to the fingers. They go down the shoulder blades, they go to the chest, they go everywhere. But what happens is, what we want to do, since the nerve roots come out towards the back, if we flex the head 20 degrees, it opens up, it starts to open up the IVF space, and as we lift up on this angle, you get more irritation off those nerves as when you lift straight up. Because the problem with lifting straight up is that it puts too much load on the jaw. And as you lift straight up, people are kind of fighting with the strap all day long rather than tugging in the back and lifting up from the back part of the vertebrae. I have done lots of cervical traction over the years, and we've experimented in all different ways, and this is the only way where I've seen people. It's the angle. It's just not lifting the head up. It's having the right angle. Okay, the next thing I want to talk about briefly is ice versus heat. Now, if you have inflammation, even if it's not recent, obviously anytime you have acute inflammation, always ice, because the ice will constrict. It will reduce the swelling, reduce the inflammation, reduce the pain. You can use that every couple hours, 15 minutes or so. Don't put the ice pack directly on the neck. Put a paper towel between it. After about 36 hours, you can start to use the heat. The heat will actually bring in blood supply, loosen up the muscle, help the area repair and heal. You never want to use heat when there's swelling. So if you have a herniated disc, or you have a bulging disc or a degenerative disc, and you have inflammation on a nerve, if you have any kind of inflammation, I don't care if it's a day, a month, a year, 2 years, 10 years, if it's inflamed, don't use heat. All right? That's the best way to tell you. And if you're in doubt, don't use heat. So in other words, ice can never hurt you. All right? If you have headaches, because I see Janet talking, okay? If you have headaches, take the ice pack and put it right underneath that skull. You guys want to look at my bald head? Here's a perfect example right here. Okay? Right here. Underneath that skull. And I'll tell you, about 80% of you are going to say thank you to me, because that headache is going to cause potential headaches behind the eyes, because the nerves under the skull go over the head behind the eyes. So you can come back to this chart on your own, and that is something I think you can learn a lot from. Okay, so we talk about the pain going down the arm. We talk about the areas of thoracic outlet syndrome. We talk about areas of forward head posture. Now you can see what happens. This is a great picture, guys. If you look at the head when it goes forward, when your head goes forward, the upper back starts to drift backwards. Now watch. Okay? Now, as your head goes forward, we start getting this hunching in the upper back. Now, to compensate for that hunching, the hips start to tilt forward. Okay? They start to go forward, start causing an anterior pelvic tilt. So the question here that comes up quite often is, with your forward head posture, or let's reverse this for a second, guys. With your anterior pelvic tilt, is that causing my forward head posture? Or is my forward head posture causing my anterior tilt? Aha. Well, guess what, guys? It can happen either way. If you think about it, you have one area of the spine here, the other area of the spine here. If this changes, then other areas above will compensate. But if something up here changes, then something down here will compensate. Your body is an adaptable human being. That's basically what it is. It adapts to its environment. So if you have areas that are unstable, you're going to have other areas. The other thing I want to mention to you is about pronated feet. I don't have the picture here, but if you're pronated and your arch is fallen, that can throw the pelvic off, as well as all the way up the neck. So make sure that if you are wearing your shoes out on the outside and you notice that you're having other problems, you can't figure out why, it could be coming from the way you're walking. Okay, guys, let me go ahead. I know we moved pretty quick here. We spent quite a bit of time here. God, we're about 20 minutes in. Let me just see if there's any last thing I want to mention, because I pretty much covered what I wanted to cover. You have lots of good resources to come back to this thing. We talked about cervical encroachment when there's nerve root on the area. You got your myotomes. You got herniation. You can see there when something's affected, how it can travel down the brachial plexus. Where the brachial plexus is a group of nerves that come off the neck. Very important. That is an MRI of a herniated disc that we touched on. We talked about pretty much what we had to talk about. Guys, I hope you learned something today. Let's go in just to a few questions. Claudia, you had 4 cervical fusions, 2 left shoulder, and a left elbow surgery. You are still having radiculopathy. Understand when you have fusions, and I thought I had a picture of a fused vertebrae. Wow, wow, wow. What happens is the vertebrae above and below start to become hypermobile. They start to move more. They start to work harder. So it's very important for you to really work on chin tucks, these chin tucks, when you're going to go ahead and just tuck back like this. You can even take a little towel, push back against it, just like this. You want to stretch those chest muscles, and you want to work those rhomboids. Go to my videos on my channel. I have lots of great instructions that will show you everything. But the most important thing for you, Claudia, is having good stabilization of the muscles. And you cannot afford to have any forward head posture. That would cause that problem to definitely get worse. Can nerve pain radiate into your face? Absolutely. The nerves that come back in here affect everywhere. Those nerves affect every cell, organ, and tissue, and every gland in your body. And if you're getting irritation on those nerves, you can get even tingling in your tongue, to your face, to your eyes. You can get really crazy type of symptoms. Sheila, recovery from concussion. Just go slow. Give your body some time to heal. Very important. Headaches, ice pack underneath the skull. I think that would be extremely important for you. You guys are kind of throwing a lot at me, which is okay. But anyways, massage is really good. But most important is good posture. Posture will destroy you. Posture will cause degeneration. We talked about this degenerative type of thing earlier. As we look at right here, let me see if I can go into this right here. That disc degeneration, it will wear it out. You cannot afford to have that type of problem. Last but not least, I want to go over this last thing about degeneration. I think this is probably one of the most important things, and I think this is a great thing for you to come back to. What did I just do with it? Hold on one second. Okay, let me see if I can just find that little lady and remove her. Okay, look at the stages of disc degeneration. All right, thank you, Catherine. If you look at a normal curve, there's a normal C-shaped curve. And that normal C-shaped curve is there to stabilize the weight of the head. In the second picture there, you can see that the alignment of the curve, stage 1, where the curve starts to become straightened out. Okay? So in other words, here's a normal curve, a perfect curve. Stage 1, the curve starts to get straightened out. As that curve gets straightened out, the discs start to have more load from the weight of the head. And then that curve can actually start to change into stage 2. Actually more degeneration. Instead of the weight going in the back part of the joint, now it's all happening in the front on the discs. And as that continues to stay like that, the discs continue to get thinner and you start developing osteoarthritis and degenerative joint disease. So very important, guys. That is how the discs degenerate. When you get burning, Olga, burning in your upper trap area, that comes from straightening of that curve. Now look, most of the time if you have a curve like this, right? This curve from point A to point B, now if that gets straighter, it gets longer. Watch my fingers from here to here. Now if I go from here to here, it stretches. So that pulling of just an alteration of a curve, as well as forward head posture, can cause that tension underneath the skull. Look at my trap exercises, my occipital stretches. I have some really, really good exercises, good stretches to help release a lot of that particular condition. Renee, we talk about kyphosis. kyphosis is going to happen, that hunching over that back. I just put another video out just yesterday about a little exercise stretch. You can get someone to stick their knee in your back as you go ahead and as you extend backwards. Great. Just check my channel. The most recent last 1 or 2 videos I put up on there. I think that will do you guys a lot of good. Okay, guys, I'm going to go ahead. We put a little time in here. I hope that you enjoyed it. Again, guys, you know, you're always asking me how do you share things. My Facebook, Motivational Doc is my fan page. I know I try to get to many questions to you guys. It's much easier there than to my email because I get so many emails. I get about 300-400 emails a day. And so I try to do everything I can do. I hope you guys really enjoyed it. I ask you to share these videos. This will be up on my video, on my channel. And I've been putting a lot of great videos on there. And, you know, they're slapping them. They're really slugging them. If you just go ahead and you go to the search here, I hope it stays this way later because when you hear it. But right now, when you're going to search and you're putting in like neck pain, all my videos, YouTube is putting all my videos up on front on the first page, like one after the other. So that tells me one thing. YouTube, I want to thank you very much. I gotta thank you. Gotta be grateful. But I want to thank you, my subscribers, my loyal subscribers, people listening to me right now, sharing these videos. They wouldn't be up on top if it wasn't from you guys. So anyways, God bless everyone out there. I hope you have a beautiful rest of the weekend. I ask you, come on, share my videos, subscribe if you haven't. If you're new, I promise you, you're going to get the best of education. I'm here for you, here to help you, to love you, to care for you, and let's do it together. Okay, guys. God bless you.